Health Canada, which is kind of like the FDA or the Food and Drug Administration here in the US, recently issued a statement that they're requiring a warning label on turmeric and curcumin supplements that there may be a risk of liver toxicity associated with taking these products. And so this might have you worried about whether or not turmeric and curcumin are actually safe to take, or should we be worried about liver damage? I want to dive into this today because as a clinical herbalist and a functional nutrition practitioner, I use turmeric with many clients. I love to use turmeric as a culinary herb. And according to Supply Side Supplement Journal, it's been the top selling herbal supplement in the natural products channel for 5 consecutive years, starting in 2019. And I can understand why turmeric and curcumin are so popular. It's supportive of reducing inflammation, supporting brain health, which is an area I focus on with many clients, and helping with digestion. There's so many things we can talk about and will talk about in terms of the benefits of turmeric and curcumin. But why are we getting this warning label all of a sudden that turmeric might be dangerous and bad for your liver? Well, I want to say, first of all, that turmeric and curcumin, what is the difference? Turmeric is the whole herb, right? The whole root or rhizome of the turmeric plant, Curcuma longa. And we can take it as food anytime you're eating a curry or a turmeric as a spice. You're getting all of those lovely herbal constituents that are part of curcumin. And there are actually dozens of different herbal constituents that contribute to the benefits of turmeric. And curcumin is just one isolated constituent, herbal constituent of curcumin. It's one of the flavonoids that curcumin turmeric contains. And there are actually many different curcuminoids in turmeric, as well as things like sesquiterpenes, monoterpenes, carotenoids, and flavonoids. And all of these different constituents, many of which are anti-inflammatory, anti-tumor, anti-carcinogenic, neuroprotective, and hepatoprotective, which means protective of the liver. So we're going to dive into that as well and talk about whether or not curcumin is safe, if you should be worried, if you should stop taking it, or if maybe Health Canada is overreacting just a little bit. Because when they put this together, they looked at the history of curcumin and turmeric supplements over a 60-year period. And they looked at the adverse events that happened in Canada, but they also included adverse events that occurred in other parts of the world. So this wasn't just from Canada and looking at certain situations where there might have been what we call an adverse event when taking a supplement or a medication. So someone has some type of reaction to a supplement or medication that's reported to, in this case, Health Canada, or here in the US, it would be reported to the Food and Drug Administration, the FDA, which keeps track of these things. Because if we're getting a lot of reports that a supplement or medication or food is causing any kind of health issue, hepatotoxicity, including death, then that's where this information is being gathered from in order to decide if a food is safe or a supplement is safe to use by the general public. So, as I said, they reviewed more than 60 international cases as well as their 60-year history in Canada of adverse events that were related to hepatotoxicity. And this was people using turmeric or curcuminoid containing health products. So, number one, they could have been using products that contain not just turmeric, but other herbs or supplements or nutrients that potentially could have played a role in these adverse events. Now, of these adverse events, again, looking at liver toxicity, they did report 12 cases of hepatotoxicity in patients using either turmeric or curcuminoid containing supplements when used orally. Now, they also say in their report that all 12 cases had insufficient clinical information or the presence of confounding factors to really link this to turmeric, that we couldn't rule out that there were other causes. And of these case reports, there were 3 deaths reported, of which 2 were attributed to hepatotoxicity linked with turmeric or curcuminoid supplements. And again, there are some other confounding factors that could have played a role here, and we're going to talk about those in a minute as well. We reviewed over 60 years of history, as well as over 60 international reports, turmeric adulteration or toxicity, and only found 12 cases, only 3 of which resulted in death. And again, we can't conclusively know that this was based on taking turmeric or curcumin. So I think that's really interesting to note because we, again, are talking about one of the most widely used dietary supplements in the world, as well as one of the most widely used culinary herbs in the world. In countries like India or Sri Lanka and other Southeast Asian countries, turmeric is a major part of the culture and consumed on a daily basis by many people. So I think we can safely say that billions of people are taking curcumin on a daily basis, and Health Canada only has 12 cases of any kind of toxicity which are related potentially to curcumin. So I think overall we have a pretty safe track record in history of turmeric use, but let's just assume for a moment that this turmeric or curcumin supplements actually caused toxicity or hepatic toxicity and liver damage for these 12 people. What might have been going on there in an herb that's used widely around the world and has been for centuries that might have contributed to this report of hepatotoxicity? Because I think we want to make sure that people really understand what this report means. Because after the Health Canada institution released this, the major media will pick up on it. And I was just looking at another article basically saying, are health supplements safe? We know that there's this potential for hepatotoxicity, liver damage, and other types of adverse events or reactions to supplements. Just this month, the Botanical Adulterants Prevention Program has issued a press release on the comprehensive review on turmeric, rhizome or root powder, and extract adulteration, looking at how supplements made from turmeric are subject to adulteration in the marketplace. And this is true in the US as well as abroad, which is really an interesting publication to look at and understand why some people may have liver damage when taking a supplement like turmeric. The Botanical Adulterants Prevention Program is part of the American Botanical Council, and their mission is really to educate the public as well as the herbal and supplements industry in getting safe and effective herbal products into the marketplace so that people get real results. And we're using the highest quality standards in the herbal industry and avoiding things like adulteration that can lead to risks like hepatic toxicity. Now, adulteration of turmeric dates back to the 19th century, and they say that at that time, turmeric was actually added as an adulterant to other spices like mustard seed because that bright yellow color, which is really those beautiful constituents and curcuminoids in turmeric, were used to color things like mustard seed and make it look a little more appealing. But now, because turmeric is such a popular herb and such a popular supplement, we see that it's becoming adulterated with things like lead chromate, which is a toxic dye used to enhance the yellow color of this powdered rhizome. And lead, obviously, is quite toxic to humans. So if you're using a turmeric product that's been adulterated, had something like lead chromate added to turmeric, then it would definitely have a very negative impact on the liver and on your health in general. Sometimes turmeric is also adulterated with things that kind of give it more substance or what they call bulking agents, like starches from lower cost ingredients, right? So if we throw a little starch in there, we can kind of get more money for this expensive turmeric powder than just plain turmeric. The sale of synthetic curcumin labeled as turmeric extract is a more recent phenomenon as well, according to this BAP report. I actually looked at a published article in Science Direct showing evidence of turmeric adulteration with lead chromate across South Asia. And I do think that you are going to find more adulteration in developing countries where the herbal industry is not tightly regulated as it is here in the United States or Canada, for example. But there are some things we can do to make sure that we are using good quality turmeric and curcumin supplements and products. Because when we look at the benefits of turmeric is anti-inflammatory and it's also hepatoprotective. So we know from the scientific research and from decades of use of turmeric that it enhances liver function and repair. Studies around this have shown that turmeric and curcumin are hepatoprotective, inhibiting oxidative damage in the liver caused by things like solvents, alcohol, medications, and viruses. Turmeric can increase hepatic glutathione levels and help prevent liver fibrosis and cirrhosis, as well as damage caused by hepatitis A, B, or C. In one randomized control trial of people with non alcoholic fatty liver disease, those given curcumin had reduced levels of liver fat, LDL, and total cholesterol and triglyceride levels, as well as liver enzymes, HbA1c, and BMI. And with so many people struggling with metabolic syndrome, fatty liver in our country today, I think this is one reason why turmeric is actually an amazing herb to support healthy weight management and a healthy liver. Turmeric has also been shown to inhibit food allergy responses as well as seasonal allergies, and it's believed to have reduced allergic response by re-regulating that Th1 and Th2 balance of the immune system, where when one is overactive, one or the other side of the immune system is overactive, we can either get a suppressed immune system or an overactive immune system. So here is one of our immunoregulatory herbs that I love to use with my clients with chronic immune inflammation to support a balanced immune system. And I want to share with you how I like to use turmeric with my clients. First of all, we can use turmeric as a food. I love curry. I love turmeric in all kinds of dishes, and this is a great, safe way to use turmeric, especially when combined with other herbs. We get the synergistic benefit of herbal medicine when herbs are combined in formulas or even again in foods. And I want to point that out because one reason why curcumin could potentially be problematic for some people is that when we isolate curcumin as a standardized extract from the whole turmeric plant, this shifts how it works in the body. A lot of the reason why curcumin is isolated from turmeric is because there's research showing that curcumin is the active ingredient that is anti-inflammatory, anti-tumor, and antioxidant, a lot of benefits. But the literature really, when we isolate a constituent like that, and we don't look at it in relationship with the other phytonutrients and an herb, we're really missing out on the metabolic conversation that an herb wants to have with the body. And the idea here is that curcumin is quickly metabolized in the gut. And we assume that means that we're not getting the benefits of curcumin when it's metabolized quickly. But what's actually happening is that our gut microbiome can biotransform curcumin into other metabolites that have other benefits to our health besides just curcumin alone. And this complete metabolic conversation of the body, I think, is really missing even in functional and natural medicine today. We're really zeroed in on a single isolated constituent like curcumin in herbs, and we're missing out on how that curcumin is just one constituent, and there are actually dozens of other phytochemicals in turmeric that have benefit. And there have been different studies that have shown that curcumin, when isolated, is not as beneficial actually as using whole herb turmeric. So when I use turmeric with a client, I use whole turmeric supplements and I also use it with other herbs in combination because we get synergy from using herbs, not just between herbs, but even within an herb, the synergy of the different phytochemicals and constituents in turmeric are really beneficial and I think safer as well. It's when we start isolating and taking higher levels of a certain constituent that there's more potential to have an adverse reaction. And what I typically see with turmeric or with isolated curcumin is generally just some digestive upset. Might give a person a little bit of a stomach ache or maybe some loose stools if they take too much. And we have less of those types of even kind of just normal reactions when we take turmeric as a whole herb supplement or food, of course. Now, the other question mark I have around the studies that were isolated for Health Canada's study on the safety of curcumin and turmeric are what other pre-existing conditions might have been part of the picture. If someone already has a liver condition, maybe if they didn't even know it, that could potentially have shown up after they started taking turmeric. So my takeaway from Health Canada's recent recommendation or requirement that the turmeric and curcumin supplements in Canada be labeled with a warning about liver health is that it's really not necessary if we know we're using reliable, good quality turmeric products. And here in the US, there are a few things we can do to make sure of that. Most quality supplements are going to be GMP certified, and that stands for Good Manufacturing Processes Certified. And this really just means that the manufacturing facility adheres to strict internationally recognized guidelines to ensure products such as supplements, as well as things like pharmaceuticals and even food, are consistently produced, controlled, and packaged to meet quality and safety standards. And this is actually regulated by the FDA as well as international regulations. So any good quality supplement is going to be labeled as GMP certified. And they're often third party tested as well. And basically, what that means is that they have been tested by an independent laboratory for things like heavy metals and other things that might contaminate a supplement, right? If curcumin or turmeric is grown in a country like Sri Lanka and brought to the US, that batch is tested for things like heavy metals, industrial pollutants, or environmental pollutants. And that way we know that it is a safe supplement. One investigation demonstrated that 4 out of 5 products pulled from the shelves of major retailers such as GNC, Target, Walgreens, and Walmart didn't contain any of the herb listed on the supplement label. That's why I think it's really important to make sure you are only buying supplements from good quality, reputable companies, and you're getting it from a good supplier as well. I never recommend buying supplements from Amazon, for example, because even if it is a good quality brand, it could have been sold by someone who adulterated it before they put it out there on Amazon to sell, or it could be expired. There's a number of issues that are well documented when buying supplements online from retailers like Amazon. I recommend using herbs only from trusted sources. I'm going to put a link below to some of my favorite turmeric supplements that you can find in my Full Script store. It's one of the companies that I use to recommend herbal products and supplements to my clients when I'm not formulating an herbal supplement for my client. In that case, I use an herbal dispensary that I know and trust that they get their herbal from a high quality source and they can then formulate a herbal tincture that I can recommend to clients based on their needs. So to sum it up, I think that turmeric and curcumin supplements are generally considered safe. You really shouldn't be worried when you're taking them in the right dose, you're using them appropriately. You're making sure that you're getting your turmeric supplements from a high quality source. And if you are experiencing any signs of adverse reactions, then definitely check with your doctor. If you are here as an herbalist or a health practitioner and you want to know more about using herbal supplements for clients, I have a free webinar on that you can check out. And if you're just here to support your own health, you can grab my free mood fix assessment below. That guide talks about how to use natural products like herbs to help support your mood and your brain health. I would love to know in the comments below how you're feeling about using turmeric now that you know a little bit more context around this recommendation by Health Canada. Are you worried about using turmeric as a supplement, or do you feel like you're safe and you're going to keep using turmeric? See you next time.